we are here at EuroPCR 2023, here with Professor Eric van Belle from Lille University Medical Center. Great pleasure to have you here.
Good morning, yeah, my pleasure too.
We have known each other for quite a while. You are a very active recruiter for the phase 3 study. Entered maybe a little late, but that was beyond your control. All kinds of issues with insurances and so etc. But a very active enroller, and I'm very happy with all your contributions. As you know, we are coming to the end of the study, and we certainly like all these sites to really put a big push for the end. And of course, we hope for a positive output response in a year time, when the year follow-up. So my question to you is your experience with the phase 3 study, and also once we have the outcome, how do you see how the QFR will be used in your center? What is the most likely application for you?
So for me, the beauty of this technology is much beyond the comparison with FFR, with spot measuring FFR. We obviously expect that it will show non-inferiority as compared to FFR. But once we have this, one very important piece of information that we get on top of the distal FFR measurement is the actual physiology map of the vessel. And potentially this can be very important for us to decide whether or not we can, with PCI, improve the distal FFR measurement, and to do so, where we should put the stent, how long should be the stent, so to be a real help in the guidance in how we should do PCI to guarantee that at the end we get a non-ischemic vessel, which is not so easy, because we know from previous studies that actually when we don't use this kind of approach in 10 to 30% of the case, the distal FFR after what seems to be appropriate PCI remain ischemic. So we need to do more, and the physiology coronary map that we can get with QFR for each single vessel of our patient is a very important piece of information.
So that goes beyond the 3D QCA, stent length, stent size, and so on, but particularly also, I guess, what we have done over the last year, focal and diffuse disease. I think that is a very important parameter.
That's true.
But then also, would you like to have all the information for all the vessels, or is it just for the vessels that where you expect that maybe you don't see that it is ischemic, but the non-palpable lesions also important?
Yes, indeed, you are right. So for me, there are two other aspects that indeed, based on this, you can have, let's say, a kind of global FFR assessment, which is also, we know now very important, that it is, and again, when we do an FFR with a wire, most of the time, you do a wire in only one vessel, maybe two vessels, but not the three vessels. And here we have a kind of global assessment of the patient itself by measuring the distal FFR of the three vessels. And indeed, in this very specific scenario of doing a non-culprit assessment of a patient with acute MI, we know that maybe wire assessment is not ideal, and there is probably some space there potentially for this kind of technology.
Yeah, so but preferably, I guess, with further automation of the technique, you would like to see all vessels analyzed.
That's true. Yeah. Indeed, because it could provide some additional value, and then to be something that could be a true patient parameter that could be used to impact the prognosis and the management of this patient based on this very important, potentially very important information, as we know.
Something like a functional syntax score,
True.
For example.
Yeah.
But then, of course, syntax score requires also a lot of visual interpretation, and it's not so easy. But if we can add the functional significance of narrowings, then that will be a complete picture.
Yeah, that's true. Or kind of just global. Again, a very easy way would be to do kind of a very global FFR. I mean, You don't have to measure anything. You have just to get the information on the distal vessel for the sweet vessel, and you get the value, and you could based on this value define what is the risk for your patient. And we have already some evidence that there is there, but again, it's almost not feasible with a wire. You need to do some. You need a different technology to be able to do this.
Yeah, yeah. And then I suppose also including an IMR.
Of course. So that is indeed a very important parameter because we have more and more evidence that microcirculation is a parameter. But again, wire technology is difficult, and wire technology can only be applied to most of the time to one vessel. And microcirculation is not one vessel issue; it's a patient issue, and you need to have potentially the IMR of your patient. And again, when you see all the option of development of this kind of technology, we see that we have there the possibility to really define clearly what is the profile of your patient based on FFR, on IMR, and to define his risk and to adapt your treatment.
We see also that also in France, but also in other countries, a specific reimbursement is very difficult. Usually now what we see, there is a complete payment for the catheterization procedure, and from that you have to decide whether you do visual interpretation or the wire or QFR. I mean, that has changed the landscape also quite a bit.
That's true. But at the same time, it could be an opportunity for because it's resolved part of the issue of reimbursement, I would say, and maybe could give some room because this kind of approach could be relatively competitive in the term that if indeed you think that you want to evaluate most of your patients, then the extra cost could be minimal, and basically for the same price than doing, let's say, 10% of investigation in your patient, you could probably, for the same price, evaluate all your patients.
Sure.
So
there are good opportunities, and we see, of course, also that physiology becomes more and more, say, practice, publications around it, guidelines coming up, and so that is also something that we are hopeful for, of course.
Yeah, of course. Yeah, you can expect this kind of thing. Yeah,
absolutely. Well, thank you so much for
my pleasure.
For your guidance in this world. And as you will see, we are continuously also improving on our solution. And we would like to show you the new version 2.2 with more automation, and we will continue to do that. And of course, continue very strongly the collaboration with you.
Thank you very much.
Thank you also very much.
Thank you.